Chapter 30, Introduction to the Hemopoietic and Lymphatic Systems. The hemopoietic system is immune response, the hemopoiesis, manufacture and development of blood cells. The lymphatic system maturates the lymphocytes and structures of the hemopoietic system as the bone marrow, blood, and lymphatic system. Bone marrow is a soft tissue that fills the spaces of long bones and the spongy bones of the skeleton and manufactures blood cells. There are two types of bone marrow, red and yellow. Red marrow is in the ribs, sternum, skull, long bones, and is responsible for the production of blood cells and hemoglobin. The yellow marrow consists of fat and connective tissue and usually does not produce blood cells unless it is in a special situation like hemorrhage, and that is when the lymphatic system also helps out with the hemopoiesis process. The structures. Blood consists of cells suspended in plasma. The pluripotentinal stem cells produce all blood cells in the bone marrow. Components of blood plasma is erythrocytes, red blood cells, RBCs, leukocytes, white blood cells, WBCs, and platelets, thrombocytes, form loose clots. Erythrocytes are flexible, anuclear, biconcave discs. Leukocytes are the white blood cells, performs many functions, and we will talk about them soon. Red blood cells, their main function is oxygenation and taking away the CO2. White blood cells fight infection. Plasma is the liquid component, contains nutrients and proteins. It'd be hard for the blood to get around if it didn't have plasma. Platelets used for clotting factor deficiencies. Then there's cryoprecipitate, which is plasma product that assists in clotting. Okay. The hemopoietic system, erythrocytes transport oxygen and remove CO2, just like I said, from the tissues. Erythropoiesis is the production of the erythrocytes regulated by erythropoietin hormone released by the kidneys. So, I mean, you look at everything that's involved in making blood. It covers a wide range of things and organs. Requires iron and B vitamins, B12, B6, and folate. Erythroblasts, immature erythrocytes. The hemoglobin carries oxygen to the cells of the body. Adult is anywhere from 12 to 17 grams per deciliter. Bilirubin is the residual pigment that from destroyed erythrocytes. Some of the factors that change the normal number of erythrocytes are age, gender, altitude. They are replaced about every 120 days. They are removed from the body by the spleen, and damaged red blood cells are taken out by the liver. Red blood cells carry oxygen to the cells, distribute nutrients to the cells for energy, carries specialized blood cells and chemicals, removes waste products from the body's cells. Folic acid, and vitamin B12 are essential for the maturation of red blood cells. Question. The nurse is educating a client regarding nutrition and the prevention of anemia and low hemoglobin. The nutrients involved with red blood cell formation include all of the following except, which one is it? Okay, which one? Here we go. It is C. Vitamin B12 serves as a coenzyme in hemoglobin formation. Folic acid and B12 are essential for maturation of blood cells, not hemoglobin formation. Okay? Little trick there. Leukocytes engulf invading microorganisms and cellular debris and manufacturing antibodies. Normal is 5 to 10,000 millimeters um, cubed. Leukocytes increase number of leukocytosis, increases the number of leukocytes. Leukopenia decreases the number of leukocytes. Lifespan is about 1 to 2 days, depending. Demand is continuous, greater in infection. And always in high demand, they are divided into two groups, granulocytes and agranulocytes. Types of leukocytes. Granulocytes, like I just said, are your neutrophils, primary component of inflammatory process. Basophils, active in allergic reactions. Eosinophils, increase in allergic, dermatological, or parasitic infections. Agranulocytes, lymphocytes, and monocytes. Neutrophils are also called macrophages, and they protect the body by phagocytosis. They ingest the bacteria and digestion of bacteria and other foreign substances. Basophils are also able to perform phagocytosis, and they are active in allergic reactions. Eosinophils are also phagocytic. Their numbers increase with allergic reactions, dermatological disorders, and parasitic infections. So they sit there and look at it. This is the way it will do. It goes out between the capillary membranes and actually attacks the bacteria outside of the bloodstream. That's what causes your pus to form, is these white blood cells that have engulfed a bacteria and killed it, and then it just sits there, and that's where you get pus formation. Okay. Okay, platelets, the thrombocytes. Lifespan is about 7.5 days, produced in red bone marrow. Migrate to injury site, release substances of glycoproteins 2B and 3A, causing platelet aggregation and formation of clot, occludes the injured vessel. They are manufactured in the red bone marrow, like I said. 2/3 of the total 150,000 to 350,000 platelets circulate in the blood, contributing to homeostasis. The other 1/3 is stored in the spleen. Plasma contains 90% water and then 10% proteins. Other blood cells, proteins, clotting factors, vitamins, glucose, lipids, electrolytes, minerals, enzymes, and hormones. So there's a lot of stuff floating around there. Plasma proteins, transport protein. There's albumin, is formed in the liver and is the most abundant protein in plasma. Then there's globulins, is also known as immunoglobulins and helps with infections. And fibrinogen helps with the clots and is one of the clotting factors. Okay. Now, blood groups. There are 4 types of blood groups: A, B, AB, and O, determined by heredity. Antigens identifying protein present or not present. Example, type O blood, no antigen. Rh factors is the positive protein present. If absent, it's negative Rh factor, negative. And then blood transfusion, both types of the and Rh compatibility type are cross-matched. O is the oldest of the blood types and is also the most common blood type. O is the universal donor as long as the Rh factors match. O negative can be given to anyone due to the fact that the protein is missing from the blood on the blood cells. AB type blood is considered the universal recipient. You might want to know that. Which one is which? O is the universal donor. AB is the universal recipient. Okay? Question. A client involved in a motor vehicle accident requires a blood transfusion due to excessive bleeding injuries. The client is typed and cross-matched for blood transfusion and is treated as having type AB blood. What blood type would be compatible for this client? Okay, so think it over. Think it over. Here we go. We're going to change. I'm going to show you the answer. Type O. A rationale in an emergency. Type O blood can be given to recipients of A, B, AB, or O. Okay? So, the lymphatic system. The lymphatics circulate interstitial fluid and carries it to the veins, filters and destroys pathogens, and removes other harmful substances. Components. There's the thymus gland, produces lymphocytes during fetal development. After birth, thymus gland programs T lymphocytes to become regulator or effector T cells, become smaller during adolescence. The T lymphocytes are formed from undifferentiated stem cells from the bone marrow and then are developed into T lymphocytes by the thymus. The major parts of the lymphatic system include the thymus, spleen, and a network of lymphatic tissue, lymphatic vessels, and nodes. Okay? The spleen, both hemopoietic and immune functions, emergency reservoir for blood, and removes bacteria and old or damaged red blood cells from the circulation. Lymph nodes is the lymphatic system, consists of vessels that drain tissue fluid. The B lymphocytes and T lymphocytes are that remove bacteria and other foreign particles from the lymph. Superficial lymph nodes located in the axilla, groin, and neck. Lymph fluid passes through the nodes. Macrophages attack and engulf substances. All right. So this is a little picture of where they're at. As you can see from the picture, the lymph system goes everywhere, and you can feel them when they are infected. There is an infection or in the body of the person. Okay. You want to get a health history assessment, obtain a nutritional history to see if the food they are eating could contribute to their issue with their blood. Prolonged bleeding from obvious injuries, unexplained blood loss, feelings of fatigue and faint with normal activities, easily chilled, frequent infections, dietary history, compromised nutrition, drug history, prescriptions, non-prescription, ASA, anticoagulants, antibiotics, cancer drugs. These all need to be known. So foreign travel, is there malaria or parasitics or roundworms, common causes of anemia? Drug history, because if they are taking aspirin or other blood thinners, they could cause bleeding issues, and some cancer medication can cause problems with their blood and lymphatic system. So you want to be careful with that. Physical exams, you want to look at their skin, inspect the color, temperature, any ecchymosis or other lesions, pulse, inadequate hemoglobin levels, lymph node palpation, tenderness or swelling, tonsil inspections, size and appearance, scale 1 to 4, any purulent drainage. With the pulse, if the client does not have enough blood, they will have a lower blood pressure and decrease in the pulsation that you feel in the extremities. Are the lymph nodes palpable in the throat, in the groin? Do they have tonsils, and how much of them can you see? Personally, I don't have my tonsils. I had them removed. I'm old enough that they removed them automatically when you were about 8 or 9 years old. They figured, you don't need them, and they just swell up and cause problems. So, anyway, diagnostic tests for the hemopoietic and lymphatic system. Blood sample, complete blood count, hemoglobin, prothrombin time, fibrinogen levels. You can have bone marrow aspirations. Schilling's test, the diagnosis of pernicious anemia, microcytic anemia, and malabsorption syndrome. Lymph node biopsies, ultrasound, spleen of the spleen, and lymphangiograph. That one's a hard one to say. A radiography, CT, bone scan, MRI. Have them explain the test and give them a few minutes to look them up and at each table. So we could take and do that if we were in class, but we're not. So we got to do it the other way. Look them all up, okay? Nurses need to monitor clients taking medication that can contribute to hemopoietic dysfunction. Medications that interfere with the hemopoietic system include, which one do you think would possibly cause an issue with your hemopoietic blood system or lymphatic system? Answer is warfarin, Coumadin. Warfarin, Coumadin, and aspirin and other anticoagulants can contribute to bleeding and interfere with the clot formation. Okay? Nursing management, you're going to take and assess the client's knowledge of procedure, offer description of the test routine, use standard precautions, gloves when collecting specimens, vital signs, notify physician regarding adverse responses, analyze and report test results. Okay. Nursing care plans for the hemopoietic system. Ineffective tissue perfusion related to reduced cellular components that are essential to deliver pure oxygen to the cells. Activity intolerance related to imbalance of oxygen supply and consumption needs. Imbalanced nutrition, less than body requirements, ineffective family coping related to the impact of the disease to the family function. These are NANDA stems. You need to know what NANDA stems are, okay? Nursing care plans continued. Ineffective breathing pattern, inspiration and or expiration, does not provide adequate ventilation. Deficit knowledge, absence of or deficiency in cognitive information, fatigue, decreased metabolic energy production, overwhelming psychological and emotional demands, family process interrupted. So those are all things that you have to look for. Okay. And that's probably what you feel like after this lecture here. So read chapter 30, understand it, and we'll go from there. I'll see you when I see you. Okay?